Someone who's pregnant may suddenly notice that her feet, her hands, the fingers are swollen hugely. There may be a swelling in other parts of the body, like lower part of the tummy, the abdomen. Now, is this of any concern? I am Dr. Rahul Sen, consultant obstetrician with an experience of 36 years. I try to clarify the condition for you now here in this video. Please subscribe my channel so that I can dish out more and more of these videos so that you have a correct understanding about the different aspects, the different problems of pregnancy. Now, why this swelling happens? This is known as edema. This may be a component of a condition which is known as a preeclampsia. Now, the preeclampsia normally develops in the late second trimester or the third trimester, around 28 weeks of pregnancy. If these sort of swelling, rise of blood pressure, etc., other aspects are there before 28 weeks, early in the pregnancy, it may be due to some other reason. But this preeclampsia usually have three components. Number one, as I said, the accumulation of water in the body. Now, actually, there is some accumulation of water in pregnancy in all the cases. About 1.6 liters of water is accumulated in the maternal body, and which can lead to a little bit of swelling of the feet, etc. This is totally acceptable, totally normal. When there is a large amount of water deposition in the maternal body, it is abnormal. Then there would be severe, if you press with your fingers in the feet, it goes down. We call it pitting edema. The other components of preeclampsia is the rise of blood pressure or the excretion of excess amount of protein in the urine. Normally, in a non-pregnant individual, about 114 milligram of protein is excreted daily. Now, if in pregnancy, this increases to about 300 milligrams. So in pregnancy, the cutoff is 300 milligram of protein in the urine for 24 hours. So if you collect 24 hours of urine and the laboratory quantitative estimation of protein is more than 300 milligram, then the lady, the mother, the pregnant mother has developed proteinuria. What is the significance of proteinuria? The significance of proteinuria is that this protein in a normal condition with a normal kidney, well-functioning kidney, would have reabsorbed this protein. But because the kidney is under stress, it cannot reabsorb the protein back, and so the excess amount is being excreted in the urine. This signifies that the kidney is being affected by the challenge, by the negative adaptation of pregnancy. So if the kidney is affected, then all the other organs may be affected. And if all the other organs affected, then the placenta may be affected. And placenta is the lifeline for the baby. It's getting the oxygen and nutrients from the mother through the placenta. So if it starts malfunctioning, the baby may be in a life-threatening situation. Now, this genetic challenge of a pregnancy often leads to this sort of severe inflammatory reaction in the maternal body, which can lead to preeclampsia. Now, so what we can do, how we can treat this? The treatment is that simple. You have to remove the challenge of a pregnancy from the mother. You have to terminate the pregnancy. Now, if the pregnancy is in too early weeks, like 28, 29, 30 weeks, the baby is too premature, we cannot do that. So we have to wait for the maturity of the baby. So we treat this condition, this preeclampsia, conservatively by giving rest, asking the mother not to indulge in any stressful activities, and constantly monitor the blood pressure, the baby's condition with the technologies we have. The modern technologies can be very, very helpful in these cases, and we can wait until the baby attains maturity. Now, this preeclampsia has 3 grades, very minor grade, grade 1 to grade 3, which can be severe. The problem is that from grade 1, it can suddenly go into grade 3 without any apparent warning. There are certain warning symptoms and signs I'm telling you, which you must remember. Like if you have Visual problem. As I said, the water accumulates in your body and it accumulates just in front of the retina. So the light passes through these water droplets and you have visual problem. Similarly, water accumulates in the brain and the cerebral edema can be fatal for the mother. So if somebody has visual problem, seeing spots in the eye, having severe splitting headache, having a right abdominal pain just below the rib cage, too much of vomiting, and the patient is jittery, feeling very unwell, and not responding to the relatives, to the husband, these are serious warning signs, and immediately the doctor and the hospital must be contacted. As I say, the treatment would be termination of pregnancy, get the baby delivered. So wait conservatively till the baby is mature. If everything is under control, then you can go for a normal delivery. But if suddenly the condition deteriorates for the baby as well for the well-being of the mother, we have to think of preterm premature delivery, maybe by cesarean section. So once the baby is delivered, once this challenge is taken off from the mother's body, then the mother improves magically. But the first few days after delivery, we have to be very vigilant because till then, certain complications which can happen, and after a week or so, the mother slowly recovers. The good news is that the damages or the problems which are created by preeclampsia does not keep any residual effect in the mother. After few months, the mother recovers completely, the kidney recovers completely, all the systems, including the liver, which can get affected, recovers completely. And that's the good thing about this condition, where the final treatment is the delivery of the baby.